morning and welcome to the program Perspectives. It's on Victor 98.9. And this morning, we're still going to take a look into COVID-19 and where we are with it in Nigeria. And of course, again, look at it world over. We're still not, it's still not Uhuru yet, as some people will say, and we're still not, the vaccine for COVID-19 has still not been, discovered, even though Russia had come with a vaccine for it, but still on check with that. But situation back home in Nigeria and in Kaduna State, the markets are opened long time, and of course we're out of the lockdown. But again, the protocols that are in place to keep us safe from COVID-19, just how are we doing with that? And of course, we're having some of our school children, some of our children are in school now because they have to, take the WAEC examinations. And so all of these and what we're having now, the churches and mosques have all been fully opened as we all have it. Markets, fully operational. And so all the places that we have people, we rub shoulders and all of that. Where we are with it now. And to share thoughts with us on the situation back home and in Nigeria, Dr. Adegboyega Oyefabi, the team lead of infectious disease control in Kaduna, and also a consultant public health physician with Barao Diko Teaching Hospital and a senior lecturer, Kaduna State University, with me in this morning in studios. Dr. Adegboyega, good morning, and glad to have you again here with us.
Good morning, Mr. Tony Alabi.
Yes.
Thanks for having me on.
Thank you very much. Okay. Let's just go straight to it. We see what we see on our streets, in our homes, sometimes would not just give us a picture of the right things to do about staying safe and keeping us, safe from COVID-19. Some people, we're back to the bear hugs. We're back, the hygienes are not being respected. And so, what the situation may be for us, we do not, again, hope to go for a lockdown. But are we doing things that may just, be, having another, round of the lockdown? We do not want it. But from your observation and what is going on now, COVID-19 is still taking it. The deaths are still, on the increase. And of course, again, we're having that, we know that people go in, get, treated and back home again with their families. But all of these, look at the situation.
Thank you very much, Mr. Tony Alabi, for having me on the program. And thank you, listeners, for listening to us. It is good for us to give a brief situation report of what we have in Kaduna State as of today. Let us understand that today is the 151 day of the fight against COVID-19 in the state. The first case was on 27th of March this year, and today make it 151 day. As of today, we have confirmed cases of more than 2,000. Actually, 2,059 cases have been confirmed in the state over these 150 days, and discharges more than 90% of these more than 2,000 patients have been discharged, which is a good news for us. Currently on our bed, we have 199 patients, active cases. And the death rate in Kaduna is 1.5% among those who have been infected. That's the case fatality rate. And 28 people have died so far of COVID-related illnesses. Kaduna North, Chikun, and Kaduna South is still leading when you talk of the epidemic of the COVID-19 in Kaduna State, followed by the other local governments like that. So we are responding, just as I've said earlier, through our the 9 pillars of response team for COVID-19 in the state: the epidemiology and surveillance pillar, the laboratory pillar, the point of entry, infection prevention control, case management, risk communication, research, logistics and supply. So all these pillars are being mandated by the state government to respond to the COVID-19 prevention and control in the state, and everybody is working assiduously to see that we bring this down as much as possible, so that our people can live a healthier life. Now, that in Nigeria, we've got more than 52,000 cases in this country today. Nigeria to have discharged about 39,000 patients. More than 39,000 patients have been discharged. And the death toll in Nigeria is now more than 1,000. But on the good news, when you compare this with what is happening in the global picture, you can see globally we are talking of 23 million, more than 23 million cases. And Nigeria, we are just talking of 52,000 confirmed cases. So God has helped us. Even in Africa, God has helped us. You can see the whole of Africa, our cases is still just about 1 million, while the world is talking of 23 million. And the mighty countries in the world, like the US, are talking of more than 12 million cases. Before, when you talk of diseases, everybody look at Africa. Diseases, ignorance, poverty. The point is always at Africa and the developing nations. But see what is happening now. This is just the message of God. And they help the rapid response from our government to helping us to control this situation. So just as you have said, I need to clarify here. I've made a media presentation on this, where somebody was going about to say, okay, this is a cure. We have found this drug can cure coronavirus. And we quickly responded because our people were asking us, doctor, is it true? Can this drug cure? And we said, look, for now, there is no cure for the COVID-19. But several drugs can be of help. We have used several drugs, some of these drugs in Kaduna State, and we have gotten a very good response. Patients have been discharged. Just told that more than 90% of our patients have been discharged. There's a way we manage them. But we cannot come out and say, okay, this is a cure. If you remember HIV has been with us now for close to 40 years. HIV can be treated. Even the viral load can go as low as 0. But nobody has talked about a cure. It was just yesterday they were celebrating eradication of polio. Look at how many years polio are in with us. So we need to understand that in the medical world, in the scientific world, we don't rush to the media. Okay, we have found a cure. There's no particular cure for now for the COVID-19. But there are several drugs. There are several ways of management that the individual can get well and be reintegrated back to his family.
Let me just quickly on that that you found ways to at least
help the patient.
Help the patient.
Yes.
This cannot be on public domain. I mean that people know that these drugs can help the situation. I mean, because here in America we're talking about statistics. They have that. They work on that.
Yes.
But back home here, we know we do not work with what people are not reporting.
Yes.
So to say. But people are also treating themselves at home.
Yes.
But can't it be made public for people to know what drugs to take on this?
Thank you very much. We have, as I've said, in Kaduna State, we have our regimen. And this regimen have a lot of classes of drugs. You have antibiotics, you have antiviral, there can be other multivitamins. There are several of these drugs that can help the patient. But you see, as physicians, we cannot just come out and say, okay, this is the drug that can help, because of drug abuse and drug misuse. And there's a need for the people to understand that individual patients are different. Patient A is different from patient B. That you have taken this, you have recovered, does not mean that Mr. B will take this to recover. And again, I've talked about the transmissibility of the COVID-19 infection. So the first thing first is infection prevention and control. If you remember last week, the WHO they declared the face masking week. If we can all ensure face masking, just picking one of these prevention strategy, face masking, is very critical to the control of COVID-19. If everybody can just ensure that face mask is worn appropriately, not nose mask as I mentioned last week, not mouth masking, not head or neck masking, but appropriate sized face mask put in place at the right time. Not that when you are talking to somebody, you remove your face mask to talk, then you put it back. If you can use the face masking effectively, I'm telling you, this pandemic will bring it down under control. So, is it face masking? We have talked about physical distancing. Some say social distancing. We've talked about cough etiquette and hand washing. These are what in public health. They call this appropriate technology. What everybody can easily do on their own to help themselves. Self-reliance, you can do it on your own. You don't need anybody to teach you. It doesn't need any special training to do all these things. And this thing is very cheap. All these methods are cheaper. Let me ask you, sir. Is the face masking not cheaper than ventilator? To put somebody on a ventilator or a machine. It's far cheaper.
Yes.
It's far cheaper. It's cheaper to do hand hygiene than to be on medication. That's why they say prevention is better than cure. So if our people can just take to prevention strategy that we have been talking about all this time, this 151 days, even before the 151 day, some of us have been involved in teaching people. Immediately we had this in China, in America, we began to train, to educate our people that this thing is coming up. But let us be careful, let us be cautious. And you can see now, people that have been affected of COVID has cut across all board. Yesterday, a very popular commissioner in this country was affected with COVID. You know, so it has cut across all board. All manner of people have been affected. Healthcare workers, we have them in Kaduna State. 10% of those who are affected with COVID-19 in Kaduna State are healthcare workers. But if you check everybody's history, ask them questions, you find out that there's a place where people have lagged in the appropriate use of this preventive strategy that we mentioned. So we should not place much emphasis on drug. Our emphasis should be on prevention. One. But the good news is this: vaccine is coming. More than 173 researchers team all over the world are working assiduously to producing vaccine, and they want to beat themselves to it. So very soon there will be vaccine. But you know, vaccine does not come out in a day. It takes a lot of this. It can take 1-2 years before vaccine. We are getting promises. You are just talking about Russia now. AstraZeneca, one of the European companies, also making promises. So there is hope of a vaccine. But you know, even the measles vaccine is here, the BCG vaccine is here, other vaccines are here. Despite the BCG vaccine for tuberculosis and others, we still talk more of prevention, personal responsibility. Make sure that you take a 2-meter distance, either in church or in mosque or in the market or in the school. Maintain a distance. Use your face mask. Wash your hand. This cannot be a new normal. I saw somebody in the market recently, and a marketer, and we asked, "Madam, you are not using your face mask?" He said it's not convenient.
I was also going to get to that even all over the world, we find out some people still say
it's not convenient.
It's not convenient. But again, it has to be worn. So, comparing that situation where back home here, is it a thing about our personal hygiene that we've not even kept to or been able to manage even before COVID-19 came up? And that's why we're having a situation on our hands today.
You see, the issue of COVID-19 is not it can be related, but it's not transmitted by maybe sewage disposal. Okay, I have not kept, maybe it's transmitted fecal oral route, all those things. So this is not the route of transmission. We know that for COVID, it's person to person transmission. It's a airborne form of infection. But you see, it's a droplet infection. When the droplet falls somewhere and somebody uses his hand to carry it, from there it can get through to his mouth, to his nose, and the person can be infected. That is why we are emphasizing on the need to wash hands. And you see, when you do hand hygiene, you do environmental hygiene, you are not only preventing COVID, you are also preventing other diarrhea-like infection. Check people who have been using face masks now. They may not complain of other symptoms, other diseases apart from COVID. They may complain less of other pneumonia or flu infection because their nose is always covered. So you see, the hand hygiene, the issue of face masking will also prevent other diseases from that person, for the person to catch or to be affected by other diseases.
Let's talk about the face mask.
Yeah.
For some people, medically recognized or accepted face mask will be said to be on one hand,
yes,
and on the other hand, we all can go to our tailors and have just and some people even do it privately. You can do it on their own and all of that. But again, breathing here, that's what some people complain about not being convenient.
Yes.
So is there a standard face mask that we almost, want to get?
See, the standard is this surgical mask.
Yes, that you have on now.
Yes.
We don't find it everywhere, but it's not common.
But the commoner one, this green and white face mask that they're even selling it across the road.
Yes.
Is that okay? This is what we call a surgical mask. Is that okay? This can be worn by anybody, anywhere, at any time, including the healthcare workers. And for healthcare workers, there are degrees of face masking depending on the kind of patient that we are seeing. You get the point? But for the populace, that surgical mask is appropriate. Then there's also cloth mask. It's
Very popular.
Very popular. But the issue is that if you are using a cloth mask, it's good to make sure that it's appropriately sized cloth mask that can cover not only your mouth and your nose, but also your chin. Big enough to serve as a face mask, the way the surgical mask will serve as a face mask. And cotton has been recommended. Cotton-like material have been recommended for that. So when you are buying face mask, the issue is that make sure that your face mask is appropriately sized, and as much as possible, it's not this kind of face mask that you wear and it's flabby and it's not firm on your faces. And that's why other authorities are recommending cotton-like material that will stay very close to your mouth and to your nose. As simple as that.
Again, transmission, we talked about that. Transmission is another issue with COVID-19.
Yes.
But again, I also will talk about the way we live, and of course we'll look at the strata of the society, that the upper,
the lower, the middle class.
And
yes.
But for the lower class,
yes,
who are in the majority, and of course we do know about neighborhoods,
yes,
and all of that. Again, saving these people from
those who are living in face me and face you places, or face me and slap you houses.
Talking about people like that,
where they are overcrowded. Yeah.
Okay.
Even in that situation, people can still protect themselves. Even when your houses seems to be overcrowded, you can make sure as much as possible that people stays maybe other parts of the building, not always getting congested inside the room at a time. Of course, you cannot say you should not sleep in the night. You can still sleep together, but people should make sure that the use of personal hygiene, environmental hygiene, should be put in place.
That's a tall order there.
Yes.
Tall order.
Yes. You see, you can clean your house, even though you are 5, 6, 7, 8 in a room, and you don't have any other place to go. You can make sure the place is clean. It's possible. You can tell your children, don't go to places that is overcrowded, so that you don't bring. We know we are all together. Our house is small. We can't go anywhere. We cannot afford to have a bigger house, like a very big man. But in this house, let's train ourselves not to go to public places without face masking and carry infection home, having known the situation at home. And when we are at home, as much as possible, other people can still manage other part of the maybe veranda outside to sit down, to relax, to discuss. But not always everybody is together in a jam-packed location. We may not help that when we want to sleep, but as much as possible, let's make sure our surrounding is clean. Let's make sure that if you are coughing, you don't cough to my mouth. I don't cough to your mouth. And let's make sure that when we go out, we observe all the other rules. If you do that, even in that overcrowded places, people can still, as much as possible, maintain some level of hygiene and personal responsibility that will help them to fight this, to prevent this infection.
We all have one element of the fever.
Yes, fever, cough.
These are things that we see and can really identify with. And when we do that, the next place is to go to the neighborhood doctor. Who may turn out to be the dispenser of drugs and all of that.
The chemist shop. Peter medicine store.
All of that.
Yes.
And so those are immediate contact points.
Yes.
I want to really tell us too that when the symptoms, when will it be as one that has gotten out of hand that may require, for us to make the calls to the COVID-19 center?
You see, as much as possible as physicians, we don't recommend somebody treating himself. Is that okay? Drug misuse, drug abuse, we don't self-medication, we don't recommend this. We believe and we teach people that if you are not feeling fine, get a medically qualified person, is that okay, to advise you and to help you with your ailment. But albeit, we know that we are living in a developed country. People will go to a medicine store, they will go to the nearest shop to go and get something. And again, we begin to train these people, we begin to talk to them. Even the Peter Medicine Store, we begin to educate them on the need for prevention protocol for COVID-19. One. Secondly, if you have been treating malaria, you're treating cough, you're treating difficulty in breathing, you are treating sore throat, 1-2 days you are not getting better, I think it's a pointer for you to go and seek appropriate medical help in a nearby clinic or hospital. And those people have been trained to recognize the symptoms and signs of COVID-19 that will qualify that person to be a suspect. Immediately they say this is a suspect. Those clinic and hospital, we have in Kaduna State, we have trained several of them. They know where to call, how to get in contact with their local government disease surveillance officer who will notify the ministry. And before you know it, the so-called NCDC people, that's what they call us, you will see them around, or they will direct you to where the sample will be taken. So people should know that once you treat malaria, you treat this for 1 or 2 days, then you are not getting well. You should seek help, appropriate help. And if you know you have come in contact with somebody who has been coughing, having difficulty in breathing, having persistent fever, and after some 1 or 2 or few days, if you are having the same symptom, it's a pointer for you to go and see your healthcare provider.
The program is Perspectives, and coming to you on Invicta 98.9, and we're with COVID-19, how far we've gone with it, and of course the challenge, and why we must still continue to keep ourselves safe by observing the protocols. The program is a Kaduna State Ministry of Health sponsored program, but we'll come back with you after this break.
Yawa company da ke yin fenti wanda kuka sani tun da dadin nan, fentin da kai fentin gidanka da shi zai zama kaman gidan turawa. Princess and Oni Paint suna nan garas da iri-iri fenti wanda in kai fentin gidanka da shi zaka gan gidanka garas kaman sabon amarya. Suna da fenti iri-iri kaman Tescoat, Emotion, Gloss, Wall Satin, Flexco, Matte Emotion. Duk wannan fenti wanda nake bayyana maka in kai fentin gidanka da shi zai sa gidanka yas kaman sabon amarya. Duk fenta da contractor ku ruga yanzu ku je baban shagon su ku je ku samu fentoci mai kyau wanda zai sa gidajen ku ai kyau kaman sabon amarya. Baban offices su yana Mass Shopping Plaza kusa da MRS Filling Station, Stadium Roundabout, kuma suna BZ Sadauna Christian gaba da Junction Road, Kaduna. Akwatin wayan mu 070 63 48 6102. Maza ku je ku samu naku.
Akwai garabasa da yawa da za a ci a gasar Nine Mobile Mega Millions Promo. A kowace rana mutum ɗaya zai ci naira miliyan 1 har kwana 90. Mutane biyu kuma su ci garabasan wayar zamani a kowace awa ɗaya a kullum. Babban albishirin shine babban kyautar da za a ci har naira miliyan 10. Idan baka da layin Nine Mobile ba mu manta da kai ba. Kawai hanzarta ka zo gunmu ko ka sayi sabon layin Nine Mobile. Akan garabasan miliyoyi da wayar zamani da zaka iya ci, za mu haɗa ma da kyautar gigabyte 1 tare da naira 500 na lokacin kira a take, kuma da garabasar datar yanar gizo na shekara 1 cur. A tuna cewa sama da mutane 4,000 ne za su samu garabasar haɗaɗɗun wayoyin zamani. Mutane 90 su ci naira miliyan 1 kowannensu. Don haka yi cajin sabuwar layin Nine Mobile ɗinka da naira 200 ko sama da haka don kai ma ka ci garabasar. Nine Mobile ta taho domin ku, ta taho domin Naija.
Baba da mama a nemi sabulun wanki na Radiant. Samari da 'yan mata a nemi sabulun wanki na Radiant. Kowa da kowa Radiant. Sabulun Radiant na haskaka wanki.
Ka fito da haske kamar lu'ulu'u. Sabon garin sabulun wanki na Radiant yana sa tsofaffin tufafi da sabbin tufa su kasance da haske mai ɗaukar ido, kuma ga rahusa da sauƙi ga aljihu. Radiant detergent powder. Tufafi masu hasken daukar ido.
Assalamu alaikum Hajiya Amina.
Wa alaikum assalam Sharifa. Maraba sannu da zuwa, shigo.
Na gode, wallahi Hajiya da alamar kina cin lafiyayyen abinci.
Me kika gani?
Ke da ƴaƴanki sai ƙara ƙyalli kuke yi.
Kai Sharifa, kina da ban dariya. To amma ai tunda muka fara cin sabuwar paketin Golden Mon na Wazobia ne.
Golden Mon a cikin paketin wazo?
Haka ne yar uwata.
Haba Hajiya, bari ni da iyali na mu ma mu mori lafiyayyen abincin mu na.
Golden Mon ke sanya kowace rana ta kasance da armashi.
Wait, stop. Who says we have to go back to normal? What if we choose to be open and say, what if I just smile a bit, travel less and love every mile of it? What if my dreams never take the back seat again? What if I'm there whenever you need a friend? See, I'll never forget how much stronger we are together. I'll carry that in my heart forever. We'll weather the storm, so I'll be open like never before.
Ready to be open? Coca-Cola.
It's 98.9 FM.
Welcome back. Is the program Perspectives this morning, and we are with COVID-19. Still talking about it, and of course, still very much around us. But again, keeping ourselves safe would be on observing the protocols that we've been told, and of course, that's what we're doing with Dr. Adegboyega Oyefabi, team lead, infectious disease control, infectious disease center, Kaduna. Also, with the, I'm sure I'm right with you, with consultant public health physician, Baraudiko Teaching Hospital, Kaduna, also a senior lecturer, Kaduna State University, with us in the studios and sharing thoughts with us. I'd like to talk about this expression of love that we all are involved in with our spouses, and this may involve contacts, body contacts, and all of that, that we have. Again, give the listener a picture of that and COVID-19.
Thank you, Mr. Toyi Alabi.
Yes,
COVID-19 will not separate one God and church together. So our populace, our people should be free to interact with their wives and to perform their marital duty. Even those that we've seen situations where husband and wife have been positive, and we have managed them. We have discharged quite a number of them.
I'm worried when you talked about droplets, droplets. And of course, with the contacts that we have too.
You see the COVID-19 diseases, we have mild cases, we have moderate, we have severe cases. The good thing is that majority of the patients in Nigeria, more than 95-6% are mild cases. And when I say mild, moderate, up to 99% are mild to moderate cases. That is the good thing.
Any reason for that?
People have postulated a lot of issues.
Yes.
Is that okay? But it's still under investigation. Some have said our environmental conditions.
Okay.
Others have said because of a particular vaccine, like the BCG vaccinations. But all these are going through a lot of research, so that I can come out with a very cogent reason why it's like that. But this I'm saying is not even limited to Nigeria. Globally, 99% of COVID cases are mild to moderate cases. Is that okay? Only about 1% is severe. And the case fatality rate, the death rate also follow suit. So the issue is that husband, wife, they can perform their marital duty. This is not the problem. We have said this is a airborne air droplet infection. Is that okay? Some few researchers have talked about some people have tried to link COVID-19 sexual relationship, but it's not well established. So it shouldn't stop our relationship with our loved one.
Okay.
And we are still emphasizing that married or married, let's keep to the infection prevention protocol. that we in the state have been talking about, and the SCDC have also been talking about. If you can keep this, everybody is safe. Will be safe as much as possible.
I talk about another expression here that is of concern. Mother to child. Yeah, I'm talking,
Great.
The newborn baby
Great.
and the child. That
Great.
relationship, that bond that we see. There again, with COVID-19, are there fears there?
Thank you very much. The first case of a child in Kaduna State with COVID-19 was a 11-month-old baby. And when we had that baby infected with the mother, we were all scared. We were like, hope the baby will not die. Everybody was running up and down to take care of that child. But to our surprise, the baby did very well and was discharged. And after that, we have had so many babies, so many children, let me use the word children, have come to the facilities, centers with their parents, and they have been managed, and they have been discharged. You see a situation whereby we even have mother breastfeeding, having another part of his family on admission, and the baby is also there. Baby is just jumping up everywhere. So we have observed that this disease seems not to be affecting our children. This is our observation. Is that okay? And again, even in Kaduna State, we begin to discuss about studying the factor, the responsible for this. Why are the children not? Because before we were saying, okay, in the extreme of age, the elderly and the children, we need to be extremely careful. But now we understand you can breastfeed your child even though you have COVID. A lot of pregnancy and COVID, somebody has been pregnant, had COVID, and the baby is well without COVID. A lot of tests research have gone to that, and they have seen that children are born even though their mother is COVID positive, but it's not transferred through the intrauterine route to that baby in most of the cases. So there's no problem. If you are pregnant, no problem. You come, but for the pregnant women, we admit them and treat them specially. We have a guideline for that to manage pregnant people. Then for babies breastfeeding, we admit them, observe them for some days, and follow our protocol to manage them. But our observation has shown no problem. Please, you are COVID, don't deny your baby from breastfeeding. Thank you.
And talk about one area that had helped. I'm sure that the public had, been informed. Awareness had been created that the mobile van that we had for testing was for a period of time, and it will move to other areas. So so at the time we had that in Kaduna, people came in for tests and all of that. Let's talk about people coming out, to get tested or to find out their status. Are we having an improvement in that? There?
Yes, there are improvements. You call it active surveillance. There are see some points in Kaduna where people are going to get tested. Because this Sabo General Hospital, people are going there, and there are provisions for testing. Sometimes we have provisions in Baraudico Teaching Hospital for people to go and test, and we are still working out some other places for testing. But this I want to emphasize. You see, people are resuming school, and schools are calling on us, please come and test us. Come and test us. You see, somebody is well, there's no problem. The person will just come. I just want to check myself. I've seen several cases. People just come to the isolation center. I want to check myself. Isolation center is not a place to check yourself, to come and test. One. Secondly, we are not going to emphasize testing more than emphasizing infection prevention control. We have about 9 million population in Kaduna. No government will commit all its resources to test all the 9 million people. One. Secondly, testing everybody today is not a guarantee that they know their result today. It's not a guarantee that in 3 weeks time, their status will still remain the same. Are you getting the point? Some people will test, they say, some people are even discharged, they say, I should give you a certificate. I say, excuse me, this is not the certificate, except it's in a special request. Because you give you a certificate that you are COVID free today, and you are not keeping to infection prevention control, what happens in the next 2 weeks, in the next 1 week? So this thing is not primarily about testing. Let's limit testing to when there is a need for testing. Is that okay? And concentrate more on infection prevention and control measures that we have been talking about. See, if this is done, if people are keeping to these rules, somebody can get COVID and get well without even knowing. And we have a lot of cases like that. Exactly. Somebody has been infected, he has recovered, and we begin to build community immunity or herd immunity against this infection, which will help us. But if we are not keeping to the infection prevention control, we'll kill ourselves and kill our populace faster than testing. And government will have committed billions, if not trillions of money to testing the entire populace. So I will advise that come for testing or request for testing when there is a need. Not that somebody who is well and had going about his work say, I want to test now, I want to test, but where can I go and test? Yeah, there is a provision for that, but that should not be our emphasis. Thank you.
Okay. All right. About time we come to the audience. What is the situation, in your area, in neighborhood, and all of that, and observing the protocols? What are your thoughts on what we see around us? Have we relaxed, because we've been out of lockdown? So have we relaxed and, we're off our guards with it? So let's get to hear you on this. And numbers to call 081 40,000 989, 081 40,000 989, or 070 87 800 989, 070 87 800 989. Numbers to call to be part of this program. Hello, good morning.
Good morning, Mr. Clyde.
Good morning.
And good morning to your guests.
Good morning.
I'm to Engineer Emmanuel.
Engineer Emmanuel.
Mr. Clyde, your guests have spoken very well. The way we are having concern, it calls for a lot of concern. These schools of ours, of our children, concerning this COVID-19. I visit my daughter's school. They are writing this exam. The only thing I saw there is just a Russian rubber. Where is the sanitizer? The government not going around now that they are writing this the junior wife and the senior wife? Are they going around? Are they people that have been dedicated to go around and see if these people are following the sit-down law of COVID-19? Are they following the law? Because it's like they just allow the people to attend to everybody. It's not done like that. Is it not in the which of the state that will have one of the girls that wants to write exam was tested positive?
Yes.
So please, we should not be doing things if it is the child of the common man, so anything goes. But if it is the children of the elite, all machinery will be put in place so that they will not be affected. So what different? Are they showing different in all these things? COVID-19 does not know the rich, does not know the poor.
Yes.
So I think the government should take action in let every person follow the rules of the guidance of this COVID-19.
Okay, Engineer Emmanuel, you made a point there, and I'd like to also add to it, make comparison with schools. Yeah, too, that this might just be the case in public schools and of course private schools, and again, you look at schools that have, will make sure that the hand sanitizers, the washing of hands are observed. But we know of schools, where you do not even find, chairs to sit on benches. And so the situation in schools like that, and so we're talking about checking, where are we with those that will help us check on how ready the schools are, because again we've talked that if we have to open the schools, we know what government said that all of these must be put in place. So checking and where we are with it.
Thank you very much, Mr. Tonya Labi. I told you we have 9 pillars who are responding to this COVID control in Kaduna State, and one of these pillars is infection prevention control pillar. And one of their mandates is to go around schools, health facilities, church, mosque, market, and other places where there will be gathering, and ensure that there is infection prevention control protocol in place. So concerning schools, I'm aware that they have started going around to some of these schools to ensure that these things are put in place. And as we are discussing here, we are still going to go back. I'm going back to the ministry. We're going to point out we're still going to remind the people in our infection prevention control of what we have done in this meeting, that there's a need for them to intensify their efforts to reach out to as many schools as possible. But the truth is that they have started, and the populace can also give us tip of schools that they know where these things are not practiced, so that our team can get there and ensure those things are put in place. But let me assure you, if any school is found wanting, or any place of worship is found wanting, there is a penalty for not putting this in place. The health workers and law enforcement agencies are working hand in hand to making sure that anybody who is not following this, any school that's not following the protocols, they are liable.
All right, I will see with your calls. Hello, good morning. Okay. Hello, good morning.
Good morning, sir.
Good morning.
Good morning, guest.
Good morning, sir.
My name is Sunday, Nigeria. Excuse me, sir. I want to ask your guest only one question.
Yes, thank you.
The question I want to ask is that if you contact the coronavirus,
yes,
if you are being treated, are you going to contact it again? Thank you.
Can I respond?
Yes, please.
Yes, you can still contract coronavirus again if you don't do infection prevention control measures. If somebody is treated now, the person is COVID free. But as I've said on this program before, COVID is unlike measles. That you get measles once, you will never get it again in your lifetime. This is not like COVID. When somebody is cured, COVID is cured. If you test him, you see that it's negative. But we advise such a person not to go to environments, places where he can expose himself to being infected again. There is no reactivation. Your body system will not say because you have gotten COVID yesterday, let COVID come back from your inside again. No. But if you expose yourself to environment or situations, you get in contact with another person who is coughing or who is a confirmed case, and you are not protected, or you are in a place, carry places where there are several people, you don't know the status of other people, you can still get it again. That's why we are emphasizing infection prevention control measures. Thank you.
Okay. All right, still with your calls. Hello, good morning.
Hello, good morning, sir.
Morning.
Good morning to the professor.
Good morning, sir. Thank you.
My name is Comrade Gabriel Tezaman.
All right, let's say
thank you, Comrade.
I thank the professor for clearing this issue of this American, as a man and a woman. Whether it's a man, because I asked that question once, and we were let know by when Dangote was having a program. So I think it's very, very clear now that we can be able to live together,
yes,
with caution. So I thank the professor for clearing that issue, and I thank the Bita also and the Kaduna State government for bringing this enlightenment program. May the Almighty God continue to bless. All of many of us are listening, and definitely we are going to follow what the professor said. Thank you, sir.
All right. Thank you. Thank you, Comrade Gabriel. All right. We can still have, one or two calls before we bring the program to a close. Hello, good morning. Yeah, again, Doctor.
Yes.
Okay, we have a call there. Hello, good morning.
Hello, good morning.
Good morning.
I'm Mr. Luca calling from Marabarido.
Okay, Mr. Luca.
In fact, prevention, they say, is better and cheaper than cure.
Yes, sir. Thank you.
And what the professor has said, at least, is that's how it is. But the fact is that what is happening here in Kaduna is like we do not follow the protocols, the preventive protocols. Yesterday, I boarded a bus from Refinery Junction to town. We paid 200 naira. That is, they have been directed to carry only 5 in a bus. But we are more than 5 in that very bus. And I was the only person with the mask. I dropped at this cooperative inside the town. I boarded another bus going to Kao. In fact, we are 10 in the bus, including the driver. None of the passengers, including the driver, was having a mask. I think I was the only person. From Kao back to town again, I decided to enter a central market. What I saw at the central market, in fact, it almost made me to cry. Completely, by the gate, if you are entering through the central market, you could see a lot of people flogging into the market without masks, flogging out without masks. So I don't know what the government will do about this. If there could be another measure, since the professor is saying you get back to the ministry and still find certain strategies to go about this, how people would now follow the protocols. So I please and I beg that actually the government should sit up and see that actually people comply with the protocol. Otherwise, in fact, we'll find ourselves in a boom. Thank you. Have a nice day.
All right. Thank you, Mr. Luka.
Okay. Thank you, Mr. Luka. Let me also join you to say that what we are observing, we too, we are observing this on daily basis, and the public stakeholders in the state and the state government and the ministry, through the Ministry of Health, they are watching this and they are making efforts to ensure that there is enforcement of the use of face masking, and those who are not complying with all the rules of physical distancing, face masking and hygiene, either in institution or individual, are brought to obey the rules of pay the penalty. So let me assure you that on daily basis we have the emergency operation center and the institution are reviewed. So as we review these cases, our rules, regulations, penalty that are already in place will be enforced, and individuals who are culpable will be brought to book as much as possible. And again, it's good to also understand. Thank you, Mr. Luka, for using your face mask. We are being in places whereby you look odd among several people using mask. You go to plaza, see finally everybody is not using mask, but it's found that very few people are using mask. Those few people are still the people that are holding forth, and we encourage them to keep on using the face masking and keeping to those other measures, so that others who are not doing it will see that what they are doing is wrong, and when they are arrested or penalized, they will know that we are justified.
Okay, we have a caller there. All right. Hello. Good morning. Good morning.
Hello. Good morning.
Yes. Hello.
Hello. Good morning.
Good morning, sir. Let's hear you. Your name?
Yes. Good morning to our person in the house.
Yes. Your name?
Yes. My name is Sam. I'm calling from Trumashi.
All right, Sam. Let's hear you.
Yes. I just have a very simple question to ask. If you have been washing, if you are exposed to washing your hand with running water and soap, if you feel necessary that you have to sanitize them again, then you just deal with the washing and then forget about sanitizing.
Okay. Yeah, doctor.
Hand washing is perfect. If you can ensure you wash your hand regularly, that's all right. Actually, in the hospital setting, once somebody is stained with blood or with feces or with any other product, you are not going to even use the sanitizer. What's recommended is the washing of hand. Sanitizer come handy. You know, you are inside a bus, you are in the market, you just touch somewhere where you are not close to your house, you need to have a sanitizer with you, so that in that places where you don't have access to washing your hand with soap and running water, you can use the hand sanitizer, and immediately you use it, it will dry your hand. It's easier to use, but it's not superior to washing your hand with soap and water. Please go ahead and wash your hand with soap and water as much as possible. And once you have done that, you don't need to put a sanitizer again.
Okay.
It's self-sufficient.
Okay, so Sam, valid point there that you made. Again, doctor, just before we bring it to a close, enforcement, is a problem here.
Yes.
We've had the mobile courts, and
yes,
all of that has been, we don't see them on the street, and so the concerns of Mr. Luka and many people about why we're not keeping to this. Is there a way that the law enforcement agencies cannot be everywhere? This is our own discipline now.
You see, the issue is this. We also have another team we call risk communication. You see, risk communication, to make sure that our people understand COVID-19, just as we are doing here, know the imports and know the problems associated with it and what can happen if they are not keeping to the rules. And for people to be well educated about this disease is better than enforcement. Because if we have brought people to the point of conviction, they can take personal responsibility. And that is what we are. That is why state government and all public stakeholders who are involved in this control are fighting to meet, to ensure that everybody understand what we are talking about and everybody can take personal responsibility. This is far better than enforcement, because once you understand what you are talking about and you can protect yourself, there's no need to come and enforce. Either we are there or we are not there, you will keep to the rule. But if you don't understand what we are saying, see the boss man now, he will pack load of passengers. Once it gets to the point where the law enforcement agent, he will ask some of them to disembark and meet him in the front after the. Who are we deceiving? If the person gets COVID, his family member will be the first to contact it, his friends and his relatives. So if you love your friends, you love your family members, you love your children, then you will know that you should not get COVID. Because once you get it, you spread it around your family members first before you carry it to the community. So this is the message. Risk communication, community participation, self-responsibility is far better and cheaper than enforcement.
Well, with your last line, just what we have to take home with, especially could you give us a rundown of the protocols, keep us safe from COVID-19?
Yes. So the conclusion of the whole matter is that take personal responsibility, stay safe, ensure appropriate use of face mask, not nose masking, not mouth masking, not an inappropriate sized masking, not using masking when you using masking appropriately. When you want to talk to somebody, don't remove the mask. Let the mask be in place. When you are in a crowded place, in a public place, put the mask. When you are at home and you are alone, you can remove your mask. Masking is only important when you are in with a lot of people. When you are in the places where there are people.
Not when you're driving alone.
Not when you're driving alone.
Yeah, okay.
But when you come to a point, maybe there's a go slow and what they call go slow, right? And people are coming to say buy this, and they are talking to you through the doors. You either wind up or you put your mask. So these are the issues. So we should ensure appropriate masking and hygiene, either with soap and water, as Mr. Luka have talked about, or the use of hand sanitizer. Cough etiquette, you say cough into your elbow, or use a tissue. And make sure you observe physical distancing, at least 1 meter from the next person. When you are in church, or when you are in the market, or in any other public places. And we should know that the easing of the lockdown, going back to school, going back to work, going back to the market, opening of the market, is not the same thing as that the COVID has ended. In fact, now we have more cases, but the good thing is they are not in geometrical. And even the case fatality is coming down. The death rate is dropping. Now, if this is the case, the only supportive way is for us to keep to this infection prevention control, so that quickly in time we can see the end of this pandemic, and it's possible.
Okay.
Thank you.
Thank you very much. And that will just be about the size of it on the program Perspectives today with Dr. Adigboyega Fabi. He is the team lead of Infectious Disease Center, Kaduna. Also a consultant public health physician with Barau Dikko Teaching Hospital. And of course a senior lecturer with Kaduna State University. Our guest this morning. Thank you for coming on the program.
Thank you, Mr. Tonyo.
And also like to announce too, we thank our sponsor, the Kaduna State Ministry of Health, for bringing this program to you. Like to thank my colleagues. Dashen, thank you for putting us, across to the people. And Wisdom, thank you for putting us in the pictures. We'll come back with Perspective tomorrow. Good morning.